And thank you for tuning in. I'm so glad you're here. So, if you are just joining, go ahead and drop in the chat where you're joining from, where you're tuning in from. Before we get started, I want to take a moment to acknowledge that we are entering Nurses Week. And that's a time where we recognize the critical role nurses play in advocating for patients, often when no one else will, right? Tonight's conversation actually sits right at the intersection of both advocacy and nursing. So, the intention for this live is actually very clear. This is about education, it's about empowerment, and it's also about advocacy. Because the reality is, too many Black women are navigating a healthcare system where they're not being heard. And that has some real consequences. But tonight is not just about the problem, it's also about solutions. It's about tools, and it's about making sure that you and the people that you love are informed, that you're prepared and protected when you're engaging with healthcare providers. So I am incredibly honored to be joined by someone who has taken her lived experience and turned it into impact. Welcome and thanks again for joining us. I'm Dr. Natasha Ramental, also known as the Medical Tourism RN. If you're new to my channel, welcome. Hit the like button, subscribe, and also share this live because it's truly impactful. Without further ado, I am going to ask my guest, Rachel. I'd love for you to introduce yourself to our audience and share a bit about who you are and what you are doing.
Hi, my name is Rachel Dumas. I am a registered nurse. I am also the founder of Heard, which is a patient advocacy app to make sure every patient is heard in a healthcare setting and thereafter. And I'm so excited to be here with Dr. Ramatal to discuss Heard and my very lived experience, to say the least. So thank you so much for having me.
No, my pleasure, my pleasure. And welcome, Dr. Walls. I see her in the chat. Thank you. Again, if you all are joining, just joining, please make sure you drop where you're joining in from. And also feel free to make comments and ask any questions as well. So we are going to just dive right into it because I know time is of the essence. One of the things I wanted to do, because I think Rachel's story is so impactful. Rachel, I want to ask you, take us back to what happened that led you to the creation of the Heard advocacy app that you created.
Absolutely. So I experienced a lot of medical trauma throughout my healthcare journey, both in my pregnancy journey and in my neurological. So in 2018, I had my first pregnancy test. It was positive, but I was bleeding. Go to the OBGYN and was told my first pregnancy would in a miscarriage. And he said, "Don't worry, you're going to have a healthy pregnancy." And that was definitely not what happened at all. I had pregnancies that ended in the toilet. I had pregnancies where I flew from Atlanta, which is a big city with multiple hospitals, to Dallas to try and save those pregnancies with surgical intervention. I had failed surgeries. I had cervical insufficiency as a diagnosis that caused a lot of losses, and I had to get a cerclage, and the first one failed. I was a victim of medical racism, dismissiveness. But after 9 pregnancy losses, I finally gave birth to my baby at 36 weeks. Yeah, I'm so excited. He's 3 years old. He looks like a grown man, but he's only 3. He does not pay bills, and he is very healthy now, even though he was a preemie.
Mhm.
But 6 months after giving birth to him, I woke up with complete vision loss and stroke symptoms, and I was completely dismissed again. I was like, "Oh my goodness, this feels like Groundhog Day." I'm starting my healthcare journey over, but I went to the ER with these symptoms, and they were stroke symptoms. And the rule of thumb is to do a CT scan, of course, for stroke. But I was told that the CT scanners were down, and I was told that I had a stomach bug,
Wow.
and neither one of those things were true.
Okay.
Um, I went,
That's a lot. Wait,
yeah.
pause, pause. Because I want to go back to, I mean, you mentioned you had 9 miscarriages, and I want to unpack that a bit because I think it's going to help a lot of other women. Because, okay, I can understand after one, sometimes
Mhm.
even two, there are times because of your age and just people saying, well, you're generally healthy, you should be fine. But I'm curious about what you were told and where did all of this all happen in Atlanta, in the Atlanta area, all 9?
It did.
It did. Okay. And then what were you told after say the second one? We know what you were told after the first one, and then after the third, and then did anyone ask you about the others leading up to all nine?
No, so after the first one, I was, like I said, I was told this is completely normal. And there's a big difference I want to point out. There's a difference between normal and common. Nothing is normal about losing a baby. It can be common, but it's not normal.
Yeah.
But I was told you're going to have a healthy baby. Don't worry about it. And 2 years later, I get pregnant, bleeding. This time I go to the ER and I find out I'm having twins and I have what's called a subchorionic hemorrhage, which is when the baby's implant, it can leave a sac of blood. Most of the time it's reabsorbed by the body, but not all the time. And it can be detrimental to the pregnancy. By the time I followed up with my OB a few days later, the bleeding was worse, severe abdominal pain, nausea and vomiting. I was sick. I was screaming to the top of my lungs in the waiting rooms, just sick. And I was sent home so many times from the OB, and I went to the ER 8 times, and I was
Wow.
dismissed. And it was just horrible. And then I lost my first baby after that. And after I lost the first baby, I felt better. My symptoms went away. I was like, okay, I'm still pregnant. It was twins. I have one. You know, what was I going to do with twins? You know how you try to convince yourself, you know, maybe that's crazy of me to have twins. That was just insane. But on the day of my gender reveal, I woke up wet. And I'm a nurse, but I'm a trauma nurse. I knew nothing about maternal health. Like, it does not translate to knowing everything at all.
Sure.
And I went to the bathroom, cleaned myself off, and about 6 hours later, my friends was over prepping for my gender reveal, and I went to the bathroom, and the baby falls out.
Wow.
And I go to the ER, the same one I've been to 8 times, and that doctor asked me, "How did you even know you were pregnant?" And
What?
I said, "Ma'am, I'm 15 weeks and 3 days, and I've been to this ER 8 times for the same pregnancy. You could look in my chart; my records are there. In addition to my OB is associated with here, you know, this hospital. We have my chart. I don't know why you're asking me this." I said, "Would you like to see a picture of the baby in the toilet?" And she's like, "Yeah."
Oh my goodness.
And I show
Wow.
her. She's like, "That's a baby." And I'm like, "Oh, yeah, that's a baby."
Oh, I can't believe this.
Yeah. So after that, I was diagnosed with cervical insufficiency. So the issue was it kept being, we didn't try this. Well, you didn't have a diagnosis yet. And it just kept, I felt like I was being medically breadcrumbed.
Mm.
And despite of all the early losses and the later ones, my OB team never said, see this, uh, we need to give you a referral for this specialist, like a reproductive endocrinologist or a reproductive geneticist. It only was that you have cervical insufficiency and you have to make it to 13 weeks to get a cerclage, which they didn't even give me the option of a transabdominal cerclage, which I could have got outside of pregnancy. But it wasn't until the manager told me, "Hey, you need to see a reproductive endocrinologist and a reproductive geneticist," that I said, "Oh, let me ask my OB about that." And she was like,
Mhm.
"Yeah, I'll give you the referral." Like, it was nothing.
No. Oh
It was
wow.
nothing. And so I saw those doctors. My genetic testing, my husband's genetic testing came back fine. The reproductive endocrinologist tested for vitamin D deficiency, which we know is linked to miscarriage, some
Mhm.
autoimmune diseases that are linked to pregnancy loss and complications. And on the day I was supposed to have an actual procedure to check check my the anatomical issues that could have been going on with my uterus, I got pregnant. And I started progesterone suppositories that a friend gave me, who is like a maternal health NP.
Mhm.
And I made it to 13 weeks, got the cerclage. That doctor was like, "Come back in 7 weeks." And I'm like, "Well, at this point, I had 5 losses. 7 weeks is
Yeah,
crazy for me, you know?"
exactly. For
She's like,
anybody though.
"For anybody,
7 weeks.
but
Much less
seven
high
weeks.
risk like yourself.
7 weeks. I'm like one of the most high risk patients. Like, 7 weeks is
Absolutely.
crazy. This is the sixth pregnancy I've had 5 losses, complete losses, and then later losses too. I don't trust myself to make it 7 weeks." And she's like,
Mhm.
"I've never seen the cerclage fail. If it does, you'll have excruciating pain and bleeding." I'm like, I'm tired. Okay, sure.
Yeah.
I'm very vigilant about my body.
Right.
I go to the appointment. Now I'm 20 weeks, right? 7 weeks later, I feel
Mhm.
great. I'm like, okay, cool. She was right. It never fails. So I'm
Mhm.
good. We're good. With 20 weeks, it's the longest we've been pregnant. I go in and mid ultrasound, that tech leaves. And then the doctor comes in who did it, and it was like, Mrs. Zuma, your cyclage failed.
Wow.
And I'm like mind blown because where are the symptoms that you said I would have? You said it would be fireworks, and I feel great. Even right now, the baby is bouncing around. I feel great. How did this happen? And she's like, yeah, there is a chance that it'll happen. I can call down to OB so you can go and deliver your baby. And she said it casually, like
Wow.
so much so that I was just like, won't the baby like pass? Like the baby
Yeah.
won't survive this? She was like, no, it won't.
Oh, wow. So
I
no bedside
said,
manner, no sensitivity whatsoever.
nothing.
Oh,
And I'm literally like shocked. And I'm like, okay, well, 20 weeks. I had to get over it real quick, right? Because we got to do something. This is an emergency. So I'm telling all my friends, coworkers, I'm like, hey, this is what's happening. I need a doctor. I'm doing research. I'm finishing my master's degree at this point. So I thought I was finishing. So I'm in the research mode. And I found that transabdominal cerclage, which is higher than the transvaginal one, can be put in place when there's a failed cerclage at play.
okay.
I had to find a doctor to do it.
Oh my goodness.
Um,
You had to find on your own.
on my own. She refused to do a second opinion or do a referral. She said that it's not standard of care. She is not doing it.
Oh,
She wouldn't
wow.
even give hand. When I finally found a doctor in Dallas, Texas, which I
Mhm.
had to fly there with a baby falling out of my vagina because of a failed cerclage,
Oh my God.
she refused to give the doctor handoff report.
Why?
She said it's not standard of care.
Wow.
So I had
Wait,
to
wait,
like,
pause, pause, pause. I have to let that sit. Okay, because this is beyond gaslighting at this point. The fact that you had to go to the ER even 8 times for prior to that, and no one paid attention, looked at the chart, looked to see what your history was. You tell them, and you're a nurse at that. So, not even considering, yes, I know OB is not your specialty, but you know clinically something is wrong.
yes,
So,
right,
the gaslighting is very, very real, especially when it comes to Black women, and especially when it comes to maternity with Black
yes,
women. And so for
absolutely.
people to be so insensitive along with that, I mean, psychologically, I'd like, before you continue, I want you to kind of touch on that and how you even kept it together, because you said you were also in school doing your master's. That's a lot.
It
That's
is.
heavy.
But I compartmentalize so well. It's
Mm.
a trauma response,
Bottom
unfortunately,
line.
but fortunately because I get things done. Very like I could just keep going. Um, but at the same time, I was in real life going through trauma that I couldn't address in real time
Mm-hmm.
at all. It wasn't until like I flew to Dallas. He did the surgery, and it's Dr. Falwell. Shout out to Dr. Falwell at Texas Health. Love him so much. If I text him right now, he'll text me back immediately. But Dr.
Wow.
Falwell, yes, he welcomed me. The staff was amazing. I mean, they rolled out the red carpet. He rolled me back. The 3 hour surgery took 8 hours, unfortunately, because of
Oh,
course I didn't get on the plane.
yeah. I
American
was going to
Airlines
ask you
was
about that. How did you travel like that? And by the way, Maya Spikes, thank you. She says, "I'm so sorry you endured this." Yeah, we all are, honestly. Tell me how you did that. How did you travel, given that the physician in Atlanta wasn't willing to do the procedure? They didn't believe it was standard of care. How did you find someone, get in contact with them, and then they agreed, and then the travel part? Walk us through that.
Yeah, so when I called Dr. Farwell's office and told them what happened, he immediately called me back on his cell phone. And we had a heart to heart. He said, if you want to fight, I'm going to fight with you. I fly women in all the time. And that was his thing. He has like articles, all this stuff. Like, that's what he does. He fly high
Okay.
risk women in. And I'm like, well, we could drive. And he said, well, from what you're telling me, I don't trust the drive. I don't want you to give birth in a car in a rural area. You don't know where you are. we
Right.
have to you have to come from Atlanta to Texas. That's a long drive.
Mhm.
He said, I need you to fly. And I said, oh, okay. I said,
Wow.
do you know it's a baby like falling outside of me? And he said, I'm aware. That's why you're calling me. However, I need you to get here quickly. We
Wow.
have the OR ready. Sit in a wheelchair, put your pelvis up, like, So
How was that flight? How long was that flight?
an hour and 45.
How,
It felt like
how,
2 days.
Yeah, I'm sure. I'm sure.
like 2 days.
I mean, how did you sit? How did you? What did you do the entire flight?
I cried. I was crying the entire flight, and so the stewardess came so many times. I was on American Airlines, and the stewardess came so many times, and she was like, "Ma'am, are you okay?" I said, "Listen, do not land this plane, but I am pregnant and there's a baby falling out of my vagina." She's like, "Hey, ma'am, what? Do you need a doctor?" I said, "No, I'm going to. If you don't land this plane, based on what I'm telling you, I can make it to the doctor in Dallas. I got to make it to save this baby. I've had 5 pregnancy losses. Do not land this plane. I got to make it to Dallas without this baby falling out of me."
Oh my
And
goodness.
she said, "Okay." And she came back and she she gave me a pin, like the American Airlines. I said, "Thank you." But you can look the look of terror on her face, like, "Oh my
Oh,
god,
oh my
oh my
goodness.
god."
Yeah,
I
she
was
said you're
like,
part of the crew now. She gave you
right.
the little.
She said, "I don't know what to do. Take this pen, please." I was like, "Thank you."
Oh,
But she said, "Anything you need? Like, you need towels?" I was like, "I hope I don't need towels. I hope
right.
I don't need towels." But I made it there. Immediately got in a wheelchair. Immediately go to the. I lay in the back of the Uber. My husband
Mhm.
sits in the front seat. I had my
Oh
pelvis
my
up.
gosh. I thought you were
And
going to
then,
tell me an ambulance. You went in the Uber.
yeah, that
Oh
would have
boy.
been great, Doctor. That's why we need you. Anyways, I was just like, just get us there,
Just
any
get me
means
there.
necessary. That would have been best, honestly.
Oh,
But I made it to the hospital. I mean, from the security, everybody knows Dr. Falwell and what he does, so
okay.
they already know if you come in for him, we already know it's serious. So,
Okay.
roll me back to my room, all these things. Give me some medicine to try to prevent contractions. Go back to the ER. 3 hour surgery took 8 hours because the baby was coming out. He had to call in his counterpart. And
Mm.
but when I woke up, I was pregnant. Everybody was literally cheering, like it was a big deal. But when the anesthesia wore off, the contractions set on,
Oh boy.
and I got so many tocolytics, which is medicine to stop contractions. And
Mhm.
despite of that, I contracted for 30 hours. I was in labor,
Oh.
and it was horrible. 30 hours straight. I was in labor, and at the end, I stood up and my water broke, and that was it. And I had to go back to the OR, get both of the cerclages removed,
Mhm.
and I delivered vaginally on July 18, 2021. A baby boy who was cremated, and there's like actually a garden where they put babies there
Yeah.
who don't make it. And I started therapy
Wow.
like maybe 2 weeks later.
Oh, I'm so sorry. I'm really sorry to hear that.
Yeah. So,
Goodness.
but the great thing is that Dr. Falwell said if that was to happen, if it was unsuccessful for any reason, that he will fly me back out
Mhm.
outside of pregnancy and put in a cerclage. And true to his word, he did. That I had some. My gallbladder went bad. I had gallbladder surgery like
Oh,
2 months later. I had some early miscarriages, and I was at 9 losses by the time Dr. Fogwell put in the abdominal cerclage outside of
wow.
pregnancy. And the next year, that was November 21, March 2022, after I did like intense trauma therapy and everything, and even did hypnotherapy, which was very
Mm.
helpful.
Okay.
I got pregnant, and I finally had my baby.
Wow. Oh my goodness. No, that is a journey. And that's a long journey. What is the time frame between your first pregnancy loss and actually having your baby?
I start my first pregnancy loss was October 2018. I had my baby December 30th, 2022.
Wow.
So
Wow.
four
That's an
years.
intense, yeah, that's an intense 4 years that you had in between. And then you talked about therapy, different types of therapy. And I'm glad that you sought that because a lot of times it's taboo, especially in the Black community.
It
So I'm
is.
really happy that you went through that. How, who did someone suggest that you go through that therapy? Did a doctor, or did you do that on your own?
No, I was in a very dark place. I just did it. I asked a marriage therapist that me and my husband at the time, well, before the journey started, had seen, and I really liked her. Shout out to Dr. Johnson. She's amazing. But and I still see her every week. But I was like, oh, I need therapy. I feel really horrible. Like I feel like
Mhm.
paralyzed. And if you know me, Dr. Raventhal, I am type A workaholic type. And I just couldn't move. And I was like,
Yeah.
this isn't something is wrong.
Yeah. Yeah.
Um and that loss knocked the wind out of me because I really
Mhm.
fought for that one. Like I really fought. So
Yeah, there's a lot that you have to unpack with that. It's not only
mhm.
the loss itself and the previous losses, but feeling almost like, and I'm speaking from experience, almost like your body has failed you as well.
Yeah, a
Yeah.
100%. It does feel like that. I felt like my body failed me. I felt incompetent. I had cervical insufficiency, or some people say your cervix is incompetent. I felt incompetent.
Yeah.
So,
Yeah.
so
Mm, that's a lot. That's a lot. I want to thank you for sharing what you've gone through. I don't want to say the story, your journey, because it's going to help a lot of people. It's going to help a lot of people hearing what you're going through, because maybe some of them are even being treated or ignored,
mhm,
or experiencing, unfortunately, some bias from clinicians, because that happens on the daily,
all the
and
time,
all the time, exactly. And
all the
one
time.
of the things that, unfortunately, if people don't experience it, they don't they don't always believe that it exists. Right?
That is
and
so
and
true.
yeah, and especially with people who are in the healthcare system, so they're just like, come on, really? Yeah, knowing that you're a nurse, yes, not OB, but still, I think that people would find it hard to believe that you've experienced that.
Yeah.
I do have a question for you about the providers, the OB
Mhm.
that you had prior to getting to the Texas OB. Was the OB someone that looked like you?
Actually, so that was a big issue, Dr. Ramantal. I was so adamant about having an all black provider, like all of my providers, not even just my OB experience, just period. And it's
Yes.
not because I don't trust white providers or any other race or
Mhm.
nationality. It's because of the research. Like I said, I've been in school all my life, still in school. I don't know when I'm gonna get out. I feel like it's jail. But so I'm so used to doing research. I'm always in research mode because of school. So I found research showing that if you're a black patient and you have a black provider, you have better healthcare outcomes. Just like if you
Yeah.
have a doula and you're pregnant, you have better healthcare outcomes. I wish I had known that during my pregnancy journey. But I was
Right.
like, at least I had that information. So I'm gonna make sure all my providers are black. They're black.
Hmm.
So the maternal fetal medicine doctor that actually put in the cerclass the first time and was very dismissive about me giving birth and refused. She was black, and
Mm.
that hurt my feelings. That really hurt my feelings. I was upset about how she acted, but I was upset because she was black. I'm like, what are you doing?
Yeah.
Like you're one of we're sisters. What are you doing?
Mhm.
And then to go to Dallas to a white man
Yeah.
who gave me this treatment, like Dr. Falwell. I tell him he can't convince me that he isn't a vampire. Like this man would be at my bedside 1 a.m., 1 p.m., 3,
Right.
like at my bedside. I'm like, do you have like a family or like any other obligations or patients? He gave me a cell phone number. He was like, text me if you need me or order something. Like
Unheard of
he's
in the
unheard
U.S.
of.
Say.
Right. But I
Yeah.
don't expect that. It's not like I
Yeah.
went to the hospital like, yeah, give me that cell phone. I don't go in
Yeah.
like that. That's just him. That was
Right.
just him. But
Absolutely.
to go from a black woman provider to a white male provider and then having better care
Hmm.
and ultimately a better outcome with
Yeah.
my white male provider, that really stung. That really
Yeah.
stung me. Um and since then I was just like, you know what? I just have to date my providers essentially and just whoever is the best,
Right.
that's what it is. That's just what it
Right.
is. So
No,
the
I'm
fact
glad you.
that
Yeah, I'm glad that you brought that up, because it's true. A lot of times, well, the research and the evidence does state that it
Yes,
for Black people, if they do have providers that look like them, the outcomes are better. I
they
think
do.
because they believe we're listened to more, that sort of thing. But it's not foolproof. It is
It's
not
not.
foolproof, and that is something that it does hurt more. You mentioned that it hurt more because
It did.
you're basically dismissed by a Black female physician, and it does hurt more because you expect more because you believe that they may see some form of themselves in you.
Yes. Yes.
Yeah, so I think that's interesting. So it does boil down to what you said. It's a dating game. You have to
It
feel out
is.
clinicians, you have to feel out their bedside manner, look them up, look up their reviews. It's similar to also once you have your baby and you're looking for a pediatrician, you have to
Mm-hmm.
date there too. You don't
You
know what
do.
you're getting into with your small baby. So, and then eventually as children. So, yeah, I totally agree. That's really interesting. Was it the same Black female for a majority of your losses before you went to Dr. Folwell?
Oh
No.
no, the maternal fetal medicine doctor that put in that cyclage and then
Mm-hmm.
it failed. I saw her twice when she put it in. When it failed, and she had that.
Okay.
That's it. That was it.
Okay. Yeah, that's enough.
Yeah, that's enough
That's
for
it.
me. So I did have to get another maternal fetal medicine doctor. Crazy thing is, my MFM was in that same office. I never saw her again. I never
Really?
saw her again. My MFM, she also was she worked at another hospital as
Mm-hmm.
like a HIV like coordinator, like big doctor with HIV. That was her real passion. Not saying
Okay.
maternal fetal medicine wasn't. She was a great maternal fetal medicine doctor. She was a white woman.
Mm-hmm.
Dr. Bedell, amazing. She listened to me. I had delivered early. But one time she was gone. She had to go to the hospital for like a big HIV symposium, and
Oh,
it was like, we have to give you another maternal fetal medicine doctor just for this visit. Do you want? I said, absolutely not. Absolutely
wow.
not. I'll skip a visit. When is she coming back? When is my doctor coming back? But I've never seen that lady ever again. And I've done so many speaking engagements, even at that hospital,
Mm-hmm.
at, at other hospitals where she works at too, because a lot of our doctors go to multiple hospitals in Atlanta,
Mm-hmm.
and I've not seen her, and I wonder if she's ever been in a crowd and she's heard the story or recognized me, but
Mm.
never. I've never seen her again.
Did they ever ask you about your thoughts surrounding them since you are a nurse?
No,
No. Yeah.
no. It's a few things like my doctors, except for one, the lady who set me up with a doctor who did my C-section.
Mm-hmm.
She's an amazing doctor. She's a black woman,
Mm-hmm.
and she was very kind, great bedside manners. She took her time for every appointment. Probably the things that Medicaid would frown upon. She took her sweet time, but she did sit me down and she was like, 9 losses and you're pregnant now. Like, how are you doing it? Like, we had a heart to heart in the office one time,
Good.
and that was the first time somebody checked in on my mental health. Was when I was pregnant
Wow.
with number 10, which I thought was
Wow.
crazy.
That's very crazy to hear that no one's asked how you're doing given your history.
Or that
Wow.
her showed up sometimes. Like, I would
Yeah.
show up like hysterically crying, and it's just like nobody checked SDOH needs.
Wow.
Like, I
For
don't know.
those of you that don't know, SDOH are social determinants of health, all the things surrounding you, where you live, food, where you work, everything that helps. Those things are also a form of healthcare because if you're
Yes,
lacking in those areas, honestly, it affects your physical.
100%. And your ability to show up to appointments, pay,
Exactly.
decide whether or not you're going to go in if you have an emergency,
Hmm.
all of these things. Nobody asks, do you have a therapist? Do you need resources?
Wow. At what
Nobody
point
asks.
did you say this has to change?
Well, when I started therapy after that big loss from that, I flew to Dallas to save. I started therapy. I did hypnotherapy because I literally had given up right after I got the trans abdominal sarclage after all the losses, and this was the last ditch effort, and I gave up after that, and I was like, oh, I can't. I feel like I can't give up because this is the last thing. Like, I have to see if it works. So I
Yeah.
did hypnotherapy, and it did. I have my baby now,
Wow.
lucky number 10. So, um, yeah, I guess like after that major loss, there was a shift.
Hmm.
And then after the final surgery, where it was like, well, if this doesn't work, we can't do this anymore.
Okay.
Naturally, of course.
Right. 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 And so let's talk about having your son, and then we'll get into the app that you created based on your entire journey. So, how was it leading into it? How was the pregnancy? All of those pieces.
Yeah. So his pregnancy was fine up until the third trimester. I was diagnosed with POTS, ortho, postural orthostatic tachycardic syndrome.
Wow.
So the day the third trimester started, I was about to say semester, but the trimester started, I woke up, I sat up, and I couldn't breathe. I stood up, I couldn't breathe. I lay back down, I was fine. Classic
Mm,
POT syndrome. Classic. Anytime you're vertical, you can't breathe, your oxygen saturation drops, your heart rate goes through the roof. Mine was in the 180s. My oxygen was
oh,
going to the 80, like 88.
wow.
So you can't stay like that, or else you have to give birth because it can cause brain damage and other issues for your baby. So I go to a cardiologist. They do some testing. He puts me on a medicine called metoprolol to decrease the heart rate. That barely worked. It went from 180s to 130s. Normal heart rate is 60 to 100 for anybody listening and you don't know. Your oxygen saturation should be 95 plus for somebody without COPD, which is me. Um, it just didn't work. So he sent me to the ER, and I had a hospital who had horrible maternal health pathways, who I
Mm,
later, literally a year ago, helped renovate their ER pathways for maternal health patients. So
wow.
I went back and worked with them because this was
That's
ridiculous.
amazing.
And when I say ridiculous, is I went to the ER. They said, "Oh, you need to go to maternity triage during third trimester." Oh, okay. Go to maternity triage. They said this is an adult health issue. Go to the ER. Roll me back to the ER. Mind you, I can't breathe. I'm vertical because I'm in a wheelchair.
Oh my goodness.
They ping ponged me until I was like,
Yeah.
"Stop, just stop." First of all, someone need to give me something to decrease my heart rate. All these things. A doctor literally falsified documentation saying nothing was wrong with me and tried to discharge me.
Oh my goodness.
So then I requested to go back to triage. Got a pulmonologist consultation. He ordered oxygen because
Mm,
my oxygen was in the 80s,
sure.
tachycardic. And I never got the oxygen. I had to deliver early at 36 weeks. My baby was 4 pounds, 15 ounces.
Wow.
You can't tell now because now he looked like a linebacker. But shout out to breast
Yes,
milk. Shout
that
out to the
still does wonders.
it
But
does.
goodness, that experience, they were just ping ponging you, and that was the experience where
Yes.
you actually had your son?
I
Oh,
had him a couple of days after that, literally like 2 days after that.
wow.
Because my oxygen would go up and they never delivered my oxygen.
Um, oh my goodness. Wow. Rochelle, that's a lot. That is a
It
lot.
is.
You literally and your son are a miracle in
Yes.
terms of being here today with all that you have endured. Honestly.
Yes. Yes.
Honestly. So
Yes.
I want to hear about, because all of this culminated in the reason for you creating the app that you created. So I want the audience to hear from you. And I think your app is appropriately named Heard. Tell us what Heard stands for and how does it work?
Yeah. So HER stands for Human Enabled AI Reporting and Documentation. And it is an app to help you, patients, to advocate for yourself in a healthcare setting. 6 months after I finally gave birth, I woke up with complete vision loss and stroke symptoms. I was misdiagnosed with a stomach bug after not being heard. And I woke up blind for 6 months. And it wasn't until I got a lumbar puncture, which showed the pressure in my head was through the roof, and that I had idiopathic intracranial hypertension. So, for no reason at all, I have an overproduction of the fluid that's naturally in our head, which is called cerebrospinal fluid. 2 years later, which was literally a year ago, um, all my symptoms came back with a vengeance, and it led to two brain surgeries, which was 8 months ago. And
Wow.
I realized I only survived that journey because one, I spoke the language. I didn't know maternal health, but I
Right.
knew neurology. I have a neuro
Mhm.
ICU background at a comprehensive stroke center, so I knew neurology.
Mm-hmm.
Um, I had, because of my history in neurology as a nurse, I was able to call connections like neurosurgeons I knew, neurologists, and say, "Hey, this is going on. I need advocacy," and they helped me. I posted on LinkedIn, and seven neurologists and neurosurgeons, neuroophthalmologists called me, and they all
Wow.
were advocating on my behalf. They gave their
Wow.
input on whether or not I need a VP shunt or the stents or both at the same time. It was so much. It was very complex case. Um, and then
Wait, while
research,
you're doing this on LinkedIn, what are your providers doing?
torturing me.
Oh my
So
goodness.
I was stuck in Kentucky, right? I live in Atlanta. I was stuck in Kentucky because I was trying to finish my master's degree, which I finished April 30th last year. May 1st, I was in the hospital, trying not to die. It's just,
Oh my
you know,
goodness. That's a
when I
year
when I
ago.
do
It's
stuff,
almost to the
yeah,
day.
yeah,
Wow.
yeah. May 1st, I was in the hospital right now, and I was
Wow.
sick. I couldn't see. I was waking up blind, and it would progress to blur vision or
Mm-hmm.
double vision or both at the same time, blur and double. I
Mm-hmm.
was vomiting 16 hours at a time. Like I was going into kidney failure because of the metabolic acidosis. I couldn't walk because of the compression on my nerves and my spinal cord with the fluid. So much. I was trying not to die and advocate for myself. And I 0 stars do not recommend this at all. At all. You need help. You need
Yeah.
somebody else who can speak the language, who you can reference to see what's really going on because you don't know what you don't know. And the research is important.
Right.
So I found that a GLP-1 decreases intracranial pressure in the disease I have within 12 to
Hmm.
24 hours of administration. And at 3 months, you don't even need the medicine that we typically take, which is acetazolamide, and it decreases the risk of mortality and it decreases the need for surgery. Since then, I've been fine.
Did you find that out on your own, or did when
Yes.
you did the research it on and kind of posted on LinkedIn, they gave you that idea?
No.
All
I was
you?
doing research when I could see
Yeah, I
later
was
at
going to
night.
ask that too.
At
Yeah, because
nighttime.
you had vision issues, blurry vision, could not see sometimes, and you were in the midst of that. You were still doing your own
I
advocacy
had
by
to. I
researching.
had
Oh,
to save my own life. Like I was June, I was planning my funeral. I was going into my first brain surgery and I was planning my funeral. I couldn't walk. It started to get hard to speak. I couldn't see. I was vomiting like 16 hours at a time. My kidneys was failing, so I was going to organ failure.
mm,
Um, I was really sick. Like I was
yeah,
really sick, and I was just like something has to happen.
right.
Something. I mean, I was updating my will, saying goodbye to my son. There were times that he spent, and I posted pictures of this, like he was in the hospital with me because I was coming from Washington D.C. to advocate, and I got sick, and then I had to leave the plane, go from the plane to the hospital.
Oh,
Um, but that's why I created the app because a constant thought that I had throughout my medical journeys was, how are patients surviving this? Like I
right,
know how much jargon I use during my neurological issue event. I know how much research I have done. I know the advocacy I had to do, literally fussing with providers. I know the connections I have where I
right.
call back home and say, hey, this neuro MP or this neurologist, like, what should I do? What's your advice? Can you talk to my team for free, right? Like completely
Yeah,
for free, and out the kindness of their heart. And I'm like, patients don't have this access. Like, what are they doing? They're dying. That's why they're dying.
yeah.
So,
Abs-
in the midst of those 2 surgeries, God put it on my heart, like you need to create something to put all this in the app to give it to patients, and I came up with Herd.
Wow. Okay, tell us a little bit more about how herd can be used.
Yeah,
What?
so it it is literally life saving advocacy in your hands. When you go into a healthcare setting, or even before or after, but it's meant to help you advocate. So if you're a caregiver or a patient, because I couldn't use my app, right? Like, especially in the morning when I woke up with vision loss, you can be a caregiver. There's a caregiver mode where you toggle and you can escalate on behalf of your family members, or if you're a doula or midwife, on behalf of your patients. But you go into the app and say, hey, I'm having this issue. Like, I woke up blind, now I have blurred vision, I'm having stroke symptoms, and they're saying, hey, this is a stomach bug. What can I do? They're not doing a CT scan. The app will literally say, this is who you talk to. This is the exact thing you say to get your provider's attention and the treatment you should do. And then the app follows up and say, hey, where are you now? Are you in the ER? Did you talk to the doctor? What happened? You can either free text, or it has like prompts. I'm trying to make it easy to say, hey, no, they're still saying it's a stomach bug. They refuse to do a CT. It will go up the chain of command. It'll tell you who to talk to, what to say, if you need to switch hospitals, how to do that safely. It educates you. If you're unstable, what about EMTALA? This is what EMTALA is. If you never heard of it, bring this up. It is very thorough. It lets you know your rights. It gives you resources. We are partnering with some major organizations, and they are adding their free resources and hotlines in the app as well. But from that case that you start, you can literally escalate within that healthcare system that you're at. So we have what's called an API, where it gathers all of the advocacy information, emails and numbers, and it takes the information you put into the app and create an email, and within 60 seconds you can escalate it. It also shows you how
All
to
of that's
escalate.
AI generated, right?
It is. It
It is.
is.
And for
Yep.
those that don't know, and ER is my background. So EMTALA that Rochelle mentioned is the Emergency Medical Treatment and Labor Act.
Hmm.
That's something that came into federal law in the United States, I think in the 80s, late 80s, but
Hmm.
it basically requires Medicare participating hospitals with emergency departments to provide medical screening exams and stabilized treatment for any emergency medical conditions, regardless of a person's ability to pay. And it prohibits those hospitals from essentially patient dumping, or transferring a patient due to financial constraints. So you
Yeah.
must stabilize them. And at that point, then that's a little bit different, but you can't turn away. You must treat someone going through an emergency condition. That's what EMTALA is.
Absolutely. So if you're a patient where you're having stroke symptoms and or active labor, like we see the videos circulating on the internet where patients are in active labor and then they go into the car and give birth 6 minutes later, like things like that shouldn't happen. You have to stabilize your patients. You have to
Yeah.
stabilize, and that's just good care. You
Right.
shouldn't leave people
Right.
like that. That's why they came to you. you
Absolutely.
know. But
Absolutely.
it allows you to advocate and escalate harm within 60 seconds. It teaches, if needed, for you to report to governing bodies such as Joint Commission or DMV Healthcare or the Department of Health, etc.
It's
But
amazing.
it follows the chain of command. But we also have in-app healthcare advocates and legal nurse specialists in there. And then there's a caregiver mode, which is really big, where you can literally follow your family member along their healthcare journey. And
Mhm.
one of the things that we want to do later on in the year is partner with hospitals, so that can also help them with their bed management and things like
Mhm.
that, and more accurately be able to follow family members along their healthcare journey, and for healthcare providers to be able to follow their patients as well.
No, no, that's wonderful. I think there's so many possibilities and capabilities of the app. You mentioned that there's a legal aspect and an advocacy
Mhm.
aspect. Do you have resources in there where essentially it would connect someone to an advocate, or what does it do when you talk about advocacy and also the legal part? I want you to touch on those
Yeah.
two.
So there's an AI advocate that you can use, but there's also a way where you could schedule appointments with a healthcare advocate. I did that because whether we want to believe or not, the advocates in the healthcare system will move in the best interest of the hospital.
The
There
hospital.
is like there are limitations. There
Yeah.
are.
Yeah.
Not to say
So
that those
sorry to
advocates are.
cut you. I have to comment on that only because I'm an independent board certified patient advocate. I wanted to share independent advocates work for you and
Right.
not for hospitals or facilities.
Right.
So independent advocates are the way to go if you end up in some of these situations where you feel you're not being cared for, because Rochelle's correct. If it's an advocate from the facility, they are typically working on behalf of the facility and what's best for the facility, not
Right.
necessarily what's best for you as a patient. Go ahead.
Right.
I
Right.
apologize.
There are legal implications, right? You have
Yeah.
to be. careful how you say certain things when you work for a hospital. You know, anything could end up in court.
And lawsuit. Yeah.
Yeah, in
Yeah.
lawsuits. So you have to protect your license. You have to protect the hospital. So, like she said, I wanted to have somebody working for you because I've been there. I've done that.
Mhm.
It's very difficult to have a run around with the person, the advocate, who's supposed to be
Mhm.
your advocate, and you can clearly see they're trying to save space for the hospital. It's not fun, especially if you're in the middle of a crisis.
Yeah, when you're most vulnerable,
Yeah,
um, unfortunately, sometimes you're pressured into decisions too because of the way that maybe it's presented to you. You
yep.
don't always have all of the facts, and that's where advocates can come in too.
Hmm.
Um, what about the legal? How would someone use the Herd app and access any legal assistance?
So I'm currently working. I can't give any names of organizations, but I'm currently working to secure some organizations that gives pro bono, so
Oh,
free
nice.
legal advice and services because healthcare is. I'm still paying on bills. Like if I hadn't went through this, I'd be in a Bugatti. I'm convinced it would be maybe a Maybach. You know, you never know. I don't know, but either one, maybe both. If I
Yeah.
wasn't paying on these bills, so I'm very adamant about like making sure we can give some reasonably priced or free services if possible. So I'm trying to partner with as many organizations that are helpful to those who are going through these issues and
Hmm.
make sure those patients have access to it because I know from personal experience. But they're able to give you uh, a 30-minute consultation and say, hey, this could be a case or this not. Because the other thing is, if you are even considering talking to a lawyer, you must have went through some type of medical trauma. Something is going on.
Right.
And the last thing again you want to do is doing research, finding a lawyer, trying to find an independent all this
Mhm.
stuff while you're sick.
Yeah.
Like,
Yeah.
if anything I wish could have happened throughout my pregnancy and neurological journey is I wish I could have just been a patient. I didn't want to use my
Yeah.
credentials. I want to just be
Wow.
sick in peace if I had to be sick.
Right. Wow. Wow. You said a word. Cassie B. Bates, 6848 says this was very informative and helpful. Thank you, Natasha and Rochelle. Yes, thank you. That's the purpose of this, Cassie. To make sure that one, you know what others are going through. Do not think because we are a part of the healthcare system that we don't experience these same things, same situations that you may experience. And I mean, from bias to being ignored, all of those pieces and anything in
Yes,
between. And then also remember, a lot of times, nurses, again, sometimes we are a jack of all trades, but master of none. So you may know a little bit about OB, but if it's not your area, you don't know. And honestly, you
you
shouldn't
don't
have to
know.
know as much as the people caring for you. They should be educating you on what your options are, and you should be more informed so you can make the best decision for you in your situation. That's the
100%.
purpose of it. Yeah,
Yeah,
absolutely.
you're the expert of your body. You can't be an expert of every specialty. Like, you just can't.
Exactly.
And we also shouldn't expect that of healthcare providers. Like a urologist can't go do neurosurgery. I promise you, you do not want that at all. You back in
Seriously.
2018, you didn't want me nowhere near a pregnant person at all. Like I'm calling OB like, oh, there's like a patient and then there's another patient inside of it. Like I don't
Yes.
know, I don't know. So
Absolutely. Absolutely. It's unique. It's very unique.
yeah.
Let me ask about the app. Would you say that this app is specifically for maternal health patients, or is this open to everyone and they can all benefit no matter what your condition is, male, female, in between, whatever people identify as?
It is for anyone going into the healthcare system or interacting in the healthcare system, or if their family member is,
Wonderful.
too, because the caregiver role is so important. Like I said, I was waking up blind every day. I couldn't use my
Mhm.
app in the morning, which is so crazy to say that. But if you or your family member interacts with the healthcare system, you should download it before because you never know when you're going to need it. And
Right.
you need a layer of protection. It's just like insurance, right? Like we get
Yeah.
insurance, we don't know when we're going to go in the hospital. The app is the same way. You need that type of coverage.
Right. Right. Is the app live now?
Yeah. So the app will be live soon. We're supposed to go live May 1st, but we have some issues I want to kink out, work out, but it will be live within the next month. So follow
Okay.
our socials to just follow our timeline. We're at My Herd app, and you could also go to myherdapp.com for updates and subscribe to our newsletter as well. We are in
At
beta testing.
myherdapp.com.
Yep,
I'm posting that for everybody. I just want to make sure. And all your socials, give that for the people. I want to make sure they know where to find you, where to find the Herd app, so that they can stay abreast of this and they can make sure that they have access to it once it's live.
absolutely. Every social media, we're at My Herd app. Facebook is Herd, and on LinkedIn is Herd as well. HEARD.
Okay. On all socials. Okay. I'm just inputting that. Perfect. Okay. And then is there a cost to the app when you do go live? I know it's coming soon.
Yeah, so the subscription started at $15 per month. However, if you refer us to your employer, HERT is an employer benefit. So if you refer us and they take us on as a healthcare benefit for you, then you have it for free. But you also get a bonus, a referral bonus. So
That is wonderful.
yeah, so I'm
Wow.
gonna put my email. So
Okay.
if you would like to participate, I can send you the form to get that done, and you can get your referral bonus.
Oh, that is wonderful. I'm going to post all of her links. She's on Instagram, on Threads, TikTok, Facebook, LinkedIn, and
Everywhere.
then the website itself, and Facebook, if I didn't mention. But I will make sure I link that in the comment section for all of you to refer back to, so you can keep abreast of what's going on with the Herd app and make sure that you get it. If you don't know about it, talk to your HR departments to make sure that you guys they can look into it, because so many organizations are looking to add this to their repertoire. Honestly, it helps keep people stay healthy,
It
healthy,
does.
and empowered and engaged in their healthcare. So honestly, I think it's a win-win situation, and for the cost, it's minimal. Honestly, it's minimal. So thank you for
Yes,
sharing that.
absolutely. Yes,
You
thank
know,
you so much. I'm
no,
excited, everybody.
yeah, no, I'm very excited for you, and I can't wait to see it and when it goes live, because I plan on getting it for myself and sharing that with my family as well, because I think it's a really useful tool to make sure that people are aware of what's going on with their loved ones as well as for
Yes,
themselves. If you are in a situation where maybe your family is not around, it's an opportunity through technology to use it for them to be engaged on your behalf. But also, if you have to do it yourself, like Rochelle did, you have access to that, you know? And what would you say, Rochelle, to maybe a woman who feels intimidated speaking up?
absolutely. So, like I said earlier, you are the expert of your body. Our providers are experts in the field, in those specialties. There's nobody that knows you like you. You're with you every day. um, and I want you to feel empowered not only to speak up, but to move on. Like
Yeah.
choosing a provider and building your healthcare team is truly that you're building that team, and you truly have to date. You have to
Yeah.
date. You
That's
have
so.
to say, you know what, this isn't serving me anymore. I'm gonna move on. We have to be able to have those honest conversations.
That's one
Um,
of the most important dates ever.
it is. It's the most important dates. Once you find a good OB, you don't want to leave. That's your
Yeah.
marriage. That's a marriage
Yeah.
at that point. But we have to date, and we have to get to know our providers. And some providers are more aggressive than others.
True.
Some you may not want aggressive treatment. You want to be passive, and that's fine. But you have to find a provider with that synergy, right? Y'all have to be on the
Right.
same page. And a doctor in Texas said, if you want to fight, I'm going to fight with you. That's my type of doctor in the middle of a crisis. But other people
Absolutely.
might be like, no, I just want a doctor to write bed rest orders so I could just go ahead and chill. But you have to know that,
That's
right?
true.
And there's a
Everyone's
doctor
different.
out there for you. There's so many
That's
fish in the sea.
There are. No, there are. And it's about doing your due diligence when it comes to
Mhm.
research. And that's with anything, but certainly when it comes to clinicians,
Yes,
especially when it comes to maternal health. And if you are a
100%.
Black woman, even more so, even
Yes.
more so. Um,
Yeah.
No, I think this has been a really wonderful conversation. I really appreciate you taking the time to come on and share your journey, because it's one that is it's really, it's interesting, it's sad, but with a happy ending. And I think one, you deserve a lot of kudos for turning your
Thank you.
pain into an app that is going to be helping others advocate for their own health. And honestly, you should be really proud of what you've created, because for a person that is in healthcare, to see you come out with an app based on your experience, I mean, that takes a lot. That takes a lot, and you have done so much on your own. And I wish you well with this app, and I can't wait until it's launched. And then after it's launched, to come back maybe a few months after, for you to just give
Yes.
us an update on how things are going,
Yes.
maybe even with a user, and then we have a conversation about how that goes. But this is something that all people need to hear about. But I have to say, especially Black women, which this YouTube channel is dedicated to educating Black women on all aspects of healthcare, and just being a nurse and also a patient advocate, which to me they go hand in hand. You can't be a nurse without being an advocate, to be
You
honest.
can't.
I
That
think
is
it's
our
important.
job.
Yeah, it's our job 24/7. It is our job. I think it's important to have had this conversation and share this extremely useful app that everyone, honestly, you guys need to get out there and make sure you're following her on all platforms, so that you can access it once it goes live. And with, it's going to be soon, because it was supposed to be May 1st. Don't worry, she's a perfectionist, as you can see. So she's getting it done so that you
She
guys
knows
can
me so
have
well. She knows me so well.
wonderful experience on the app, so that you can advocate for yourself or your loved ones. And with that said, I want to one, give you an opportunity to give any closing remarks before we go. I know you've been on for almost an hour, and I appreciate your time. I know your little one is there waiting on you, and I want to make sure you're able to put him to bed.
Yeah, absolutely. Trust your body, and don't let anybody tell you that your symptoms are not your symptoms. Trust your gut. Trust your intuition. It's there for a reason. It's protection.
Yes. Oh, thank you for that. And for me, what I would say is stay tuned to her, follow them on all platforms, so that you're ready whenever it does launch. Follow Rochelle on her platforms as well. I put all of her links in the comment section, and share this live with others, and also hit the like button, guys, just so that it can hit the algorithm, and this conversation can be shared with others who need to hear it. We know that others may not have had the time to join live, but we need to make sure that it gets out there so that they can hear about Rochelle's experience, and also about the app. Make sure you're introducing any type of advocacy for yourself, for your loved ones, through this app, or just pointing them in the direction for it, because this isn't just information, it is also protection.
It's
Okay.
protection.
So, yeah, absolutely. Your voice matters, your life matters, and you deserve to be heard. Right. And that's so
Yes.
appropriate for Rochelle.
Thank you for that. I'm gonna put you on that commercial for the Super Bowl.
No, thank you for your time. And everyone, thank you for joining, and stay on, Rochelle. But that's it. That ends our live. You all make sure you share it with the loved one. Thank you so much for tuning in. Take care.